Broadcasting live from the Business RadioX studios in Atlanta, Georgia, it's time for Atlanta Business Radio. Brought to you by OnPay. Built in Atlanta, OnPay is the top-rated payroll and HR software anywhere. Get 1 month free at onpay.com. Now, here's your host.
Lee Cantor here, another episode of Atlanta Business Radio, and this is going to be a good one. But we couldn't be doing this work without the support of our sponsor, OnPay, so please support them so we can continue to share these stories. Today on Atlanta Business Radio, we have Emily Tyson, and she is with Radix Health. Welcome, Emily.
Thank you, Lee. Excited to be here today.
Well, before we get too far into things, tell us about Radix Health. How are you serving folks?
Sure. So Radix is a patient access software company. So we work with large medical groups and health systems around the country to make it easier for patients to see their doctors and for the practices to actually manage the operations on their side to make that possible.
So now, if you weren't around, how would they be doing that kind of thing?
A lot of it happens, you manage it with the calendar. And so you've got someone or many people with Post-it notes and paper with trying to remember, what are all the rules around patients and which doctors will see which types of conditions or complaints when a patient calls in. And so what we do is we take all of that's living in people's heads and on paper and actually automate it to try to figure out how to better match, what is the supply of available appointments with the demand from patients that are coming in the door, and find it really works better. Patients can see doctors much more quickly in most cases, and doctors are able to better see the right patient. So you're really matching and finding the appropriate appointment for that patient.
Now, because of the pandemic, have things changed? I know in my own personal life, I'm not too thrilled about going to my primary care doctor because I don't want to be around sick people. So has this impacted your business? Are more people leaning on your kind of service because that's just a more efficient way to manage kind of the inflow of patients?
Oh, it's a great question. And it's really a mix. So there's two parts to it. I would say on the one hand, our clients have certainly been impacted and affected by the crisis. If you think about it, elective procedures, for example, could not be seen. And so patients could not go. And so, patient volume, appointment volumes were down significantly. It would impact their operations and financial positions. And then you've got patients waiting for care and couldn't see it. So we've been working with them to manage through that, and clients having to do that. A lot of what they have done where we've worked with them is actually how do they increase their telehealth capacities? And then as the market are slowly starting to resume, where they are able to see elective procedures, kind of facilitating reopening plans and having to do that. But there's been a pretty serious impact. Exactly as you said, patients can't go to the primary care doctor. And so in general, the practices have been very limited in what they're able to do. They've responded quite quickly, and we've been working with them in how to use the digital health solutions to both manage patients more effectively remotely, thinking about tools like telehealth and virtual visits, and how you turn that on quickly and make it work across a number of locations, providers with different types of appointments, while also now looking to the future and kind of how do they operate in this new normal and how our tools can support them.
Now, what about for your firm dealing with the remote work? Is that something you had been doing in the past?
We had not done much remote work in the past, though as a technology company, I would say we were fairly well suited for it. So, of course, it was a transition and, you end up with Zoom meetings and connectivity challenges. But overall, for us, it was a fairly seamless transition. And we've taken extra steps in that process to think about, for our team members who have been as busy as ever, how do we better support them? And it is everything from, equipment from the office. We've had people go home and take their desk chairs home to make that transition a little bit easier, I would say, and really making sure we keep our clients at the forefront, knowing the impact that this has had on our clients and thus on their patients as well.
Now, how did the whole idea come about for Radix? Like, what was the genesis of your origin story?
Absolutely. So two of our co-founders, Dr. Arun Mohan, who is our co-founder and CEO, is actually a physician by training. And the idea started, he was trying to get a patient in to see a specialist and was told, sorry, patient's got to wait. Appointment will be, 3 weeks out, for example, really hard. He was frustrated. Patient can't wait that long. It just so happens the physician with whom he wanted the patient to have an appointment, he saw in the doctor's lounge later that day and said, oh, it sounds like things are going well. You're really busy. And actually she said, I'm really not that busy. I don't know what's going on with my schedule. They're doing something, have the patient see me first thing in the morning. And it turns out that is actually a very common problem that happens. And that's where this whole, who do you know? And do you know someone? That's how you get your doctor's appointment. Doesn't really work for patients, and it doesn't really work for doctors either. And so he then partnered with Anup Lakare, who is an industrial engineer, supply chain background, to think about this and apply some of those principles around really maximizing supply and demand and optimizing it from that perspective to bridge that gap.
And then how'd you know that this was going to work for others? Did you have the ability to kind of beta test in other practices and then get some feedback? Like how did the learning go at first?
Yes. So Radix actually initially partnered with a large gastroenterology practice here in Atlanta, and really sat side by side with the scheduling team who managed kind of most of this, what we think was the front door of access for patients to the practice, understanding how they operated, what the workflows were, what the day-to-day challenges were, and how we may apply those learnings to technology, what could be automated, what could not, what was the intelligence that needed to live in the solution. And so we were lucky enough to be, really working hand in hand with that organization at the start. And really for the first 2 years as the company was building out and figuring out what exactly is the solution, how do we solve it? And then working with other local practices and growing from there. And, everyone, there's more learnings, but it turns out they have a lot of shared challenges across them. So we really benefited from close partnerships with our early customers who are willing to kind of open the kimono and let us see how they worked and what they struggled with so we could figure out how to solve it for them.
So now what stage are you at now in the growth of the business?
So we have grown over the past, just 5+ years. We've grown to, we're in over 30 states now. We have about 5,000 providers that we're serving across the organization, and about 70 employees. So we've grown quite quickly, and I would say we are growing incredibly quickly, certainly before COVID-19 pandemic impacted things earlier this year.
And what's the sweet spot for a good client for you?
There's a pretty big range. Typically, it's going to be a larger medical group, multiple physicians, multiple nurses, physician assistants, multiple locations, and can be from that size, call it, if you have 10 doctors in a practice to thousands of doctors if you're working for a large health system across specialties and everything else. There's a wide range. Where it is less of a sweet spot tends to be, if it's an independent, single one or two, a very small practice, the complexity of managing across locations and times of day and which doctor will see which patient doesn't exist. And so we're able to add significantly more value in the larger practices who are really trying to coordinate and optimize not just for one individual provider and one set of patients, but across many of those, and how you do that as one combined network.
Now, is it kind of agnostic when it comes to the specialty? Like, would this work for an orthopedist as well as it would work for just general practitioner or even a dentist or a plastic surgeon?
Yeah, absolutely. It is agnostic. The way we think about implementing the tools and some of the things we do to configure it will vary a little bit by specialty. Some of the unique aspects of it can differ. And so you think about, for example, orthopedic practices, one thing that's really important is with new patients when they first come in the door, how do you decide which physician that new patient should see if they don't have a specific referral or request? That's a really critical part of their operations. If you think about women's health, for example, how do you make it easy to schedule sequential appointments? And so there are some differences in how the solutions may be applied and used. but it's really built to be something that can serve all the different aspects of the market.
Can you share a story maybe where you came into a practice that didn't have anything like this and were able to really make an impact? I mean, you don't have to name their names, but maybe just tell the story about it.
Sure. It's funny. For some parts of our solution, we have a platform and there's several different products on it. And, you would think that in many cases we're replacing an existing solution, but in most cases we're really not. It's a new area and we're replacing paper. And so I can think of a local client where we went in and sorted things and improved. The first pain point was scheduling accuracy, for example. So they had just tried to consolidate, whereas opposed to, you have a different person who handles scheduling, one person who manages the schedule for Dr. Smith, another person who handles the schedule for Dr. Thomas, and so on. You have a group of people who can schedule across all of them. As you can imagine, that's really challenging because then you have to understand the rules related to it for every single physician that's there. And trying to centralize that is quite hard. So they were really struggling with accuracy. Patients were showing up for appointments. Providers are saying, I don't see this type of condition. How do you get it right? And so we were able to improve within the first 3 months, improve scheduling accuracy is how we think of it. Did the patient get to the right provider, the right appointment, to over 99%. At the same time, utilization, which is how we think of how busy are the providers? Are they sitting there, with gaps in the schedule, or patients actually getting in the door? Do they have full schedules? Improve several percentage points, which is something that is very meaningful to be able to deliver that increase in activity without needing additional resourcing for the practice. And patients can get in that much faster. And then also improving their online presence and getting newer patients and more patients able to find something online without having to call around. And you can imagine how hard it is to book an appointment during the day if you have to actually speak to someone on the phone. And so there's a lot of different angles where we help, and it's really a combination of having the practice be more efficient and really making sure patients are getting to the right provider. And for patients, just giving it more of a modern consumer experience and being able to book an appointment online at your convenience, which we can do for a lot of other things in life, but for healthcare appointments is still quite challenging in many cases.
Now, I assume it plays nicely with all the other software that a practice would need and use regularly. Is that accurate?
It does. We invested a lot, from the very beginning, and we continue to invest a lot in terms of our R&D resources and how we play with the other solutions that practices are using. The most important, of course, is, the electronic health record or the practice management system that are, containing all the clinical records and all of the billing records. So a significant portion of what we do is devoted to ensuring that data is flowing really seamlessly between those systems to make it easy for the practice and to make sure that the information for the patient is there and it's consistent.
And then I'm sure it's also flexible in times like this. Like I know I went to the dentist recently and they had a new onboarding. I had to fill out some special forms because of the pandemic that required me to do certain things certain way. I had to text them in the parking lot. You're able to kind of integrate all of those pretty easily from a patient standpoint.
Absolutely. It's been really interesting to see as we think about the changes we've made to better help our clients and our patients navigate through the COVID-19 pandemic. And for the most part, because our tools were built around how do you make it easier for patients to see their doctor, how do, physician practices actually manage the operational implications of seeing patients, we were really uniquely suited to do this. And some of the pieces we've been most focused on enhancing are exactly what you said. How do you make sure you're creating a completely, contactless check-in? It's, having forms filled online ahead of time, having payment online ahead of time, alerting the patient to, notify the practice when they arrive. And so they're not sitting in the waiting room with a crowd and waiting. So how do you do things like that? There's been a lot of activity around supporting telehealth and driving activity there to enable virtual appointments where appropriate. And a lot of the campaigning. One thing that has been consistent over the past several months is every day is sort of a new day. And what that means for practices and their patients changes. with that. If not once a month, it's been once every 2 weeks, once every week. For some practices, they've had operational changes every day. A location might close because there was a patient that had been diagnosed or someone had been exposed. And so enabling very rapid communication out to patients appropriately has been a significant focus area for us as well, to really make sure that the patients can stay informed as the practices are also navigating what the world looks like, given how quickly it's all changed.
Now, you mentioned that there's like a suite of kind of software they can buy. Is this something that there's a point of entry that a new customer goes through? Usually they try it with kind of maybe one aspect of the software, and then it just kind of expands as they feel more confident?
It's really changed. And I'll tell you, so there are 4 products typically that we think about within the platform. There is one that is used as a front desk, someone working in the call center, managing phone calls to schedule a patient. It's the workflow that they work through to understand the rules and book the appointment. You can think about kind of air traffic controller for the practice that they're really navigating. There's then a version of that's the patient-facing online self-service application where the patient doesn't have to call, they can actually book an appointment. And it's critical as they book an appointment because often for practices today, when you want a doctor's appointment, what you're doing online is actually requesting an appointment, and you still have to have that phone call back and someone has to talk to you before they can confirm it. But since we have built the same engine behind it and the same rules and preferences behind the scenes, patients are able to actually complete the booking process online. With that, the third one is a communication layer that I mentioned of, enabling campaigns, whether it's as simple as a reminder or something more complex like care planning and preparation of what needs to be done prior to an appointment. Right now, we've seen a lot of communication related to what to expect when you arrive, since it's a very different experience than prior to COVID-19. And then there's also this check-in component of what is that digital check-in? How do you limit as much contact and time needed in that waiting room as possible? Historically, if I went back in time 2 years, the first product that I mentioned, that kind of deep operational scheduling tool, really was the starting point for many of our clients. What we have seen recently is a rapid shift where the online self-scheduling, the patient communications, and check-in actually are the rapid starting point. They need a way, how do they interact with, stay in touch with, and enable patients to operate more independently throughout this process. And so there's been a rapid shift there, but all of the products work, together or standalone. And so it really depends on where a client or prospect, would be in their journey and what they really need to improve their operations.
And if somebody wanted to learn more and have a more substantive conversation with you or somebody on your team, is there a website?
Absolutely. So it is easy enough. It's radixhealth.com, and Radix is RADIX. So just radixhealth.com, and you can certainly find us online.
Well, Emily, thank you so much for sharing your story today.
Thank you. I appreciate the opportunity to chat, and I hope you have a great day, Lee.
All right. This is Lee Cantor. We will see you all next time on Atlanta Business Radio. And remember, we could not be doing this work without the support of our sponsor, OnPay. So please support them so we can continue to share these important stories.
Today's episode of Atlanta Business Radio is brought to you by OnPay. Built in Atlanta, OnPay is the top-rated payroll and HR software anywhere. Get 1 month free at onpay.com.